When it comes to mental health, the United States has a long way to go, from caring for those with mental illness to changing public perception. And often we get it so wrong. Here are 4 myths about mental health in the US. Myth number 1, mental illness is rare. Actually, 1 in 4 adults experiences mental illness every year. That includes everything from depression to eating disorders, OCD, and schizophrenia. Even celebs like Jon Hamm, Lena Dunham, and Lady Gaga have spoken out about the importance of addressing mental health issues of their own.
Bipolar depression really got my life off track. But today I'm proud to say I'm living proof that someone can live, love, and be well with bipolar disorder when they get the education, support, and treatment they need.
Myth number 2, if the mentally ill just wanted help, they could get it. Well, getting treatment in the US is not so easy. 90 million Americans live in places without easy access to mental health assistance. Between 2009 and 2012, states cut $5 billion from mental health services. In 1950, there was 1 psychiatric bed for every 300 Americans, and in 2010, that number was 1 in 7,100. How did it get so bad? In the 1980s, President Ronald Reagan nationalized a trend that started in his home state of California, moving people out of hospital psychiatric wards. Federal mental health spending went down by 30%. Many were left without proper care, often becoming homeless or imprisoned. Today, up to 30% of homeless people have a serious mental illness. That's 5 times the rate in the general population. And there are 10 times as many mentally ill people behind bars as in state hospitals. Myth number 3, mentally ill people are violent. When we do talk about mental health in the US, it's often on the heels of tragedies like murder.
The co-pilot who crashed Flight 9525 into the Alps, killing 149 people and himself, had a mental illness.
CBS News has learned that James Holmes had seen at least 3 mental health professionals.
Lanza had significant mental health issues.
But only 3 to 5% of violent acts in the United States are committed by people with serious mental illness. In fact, people with mental illness are 10 times more likely to be victims of violent crimes than the rest of society. And of the 38,000 people who commit suicide each year, it's estimated that 90% have had a mental illness. And people with serious mental illness die up to 23 years sooner than other Americans. Myth number 4, fixing the system is just too expensive. Well, taxpayers actually end up paying more for the consequences of mental illness than they would for preventative treatment. For every $2,000 to $3,000 spent each year on treating the mentally ill, $50,000 is saved on incarceration costs. So after all this, maybe it's the system that's truly insane.